Hello, my name is Nicole, and I'm going to be discussing the efficacy of marine-derived compounds for the treatment of glioblastoma multiforme. So first, I'm going to go over the characteristics of glioblastoma as well as the available treatments for patients diagnosed with glioblastoma. So first, glioblastoma is an aggressive stage 4 cancer of the brain, and it has a median survival rate of 9 months, meaning that from the time that patients are diagnosed to their time of death, the median is 9 months. Symptoms for patients diagnosed with glioblastoma include headaches, neurological deficits, and seizures. And for a brain tumor to be considered a stage 4 glioma, it has to be seen on MRI with necrosis, as seen here. Currently available treatments for glioblastoma include radiation therapy, surgical removal of the tumor, and temozolomide chemotherapy. So why isn't surgery an option? Well, while surgery can reduce the size of the tumor and in some cases even remove the entire tumor, it is not considered a cure for glioblastoma. Many times, surgery isn't even possible because of the size of the tumor, the location of the tumor being inaccessible to surgeons, or the tumor just invading vital structures in the brain or blood vessels. Recurrence of the tumor is very prevalent, over 90%, because glioma cells are so migratory. So why is glioblastoma still incurable? Another reason is temozolomide chemotherapy resistance. Temozolomide works by methylating guanine and adenine at the N3, N7, and O6 sites, as seen here. This methylation destabilizes DNA and basically helps to halt DNA replication, effectively helping to stop the tumor from growing. Patients that have temozolomide resistance usually have increased methyltransferase activity, and methyltransferase removes these methyls from these base pairs, basically doing the opposite of what temozolomide is intended to do. So why are marine sponges and cyanobacteria of interest? Well, many sessile marine organisms have actually been found to contain many anti-cancer compounds and to produce many anti-cancer compounds. And because chemotherapy and other treatments for glioblastoma have been found to be unsuccessful, further treatments and other treatments need to be looked for and tested in order to effectively treat and improve the quality of life of patients diagnosed with glioblastoma. First, I'm going to be discussing Polymastia generensis. Polymastia generensis is has an unidentified composition. So the extracts of the sponge have not been identified. It's found in Brazil, and it was first found to have anti-cancer properties in 2009. Polymastia generensis extracts increase cell death of glioma U138Mg cells. So as we can see here, these are U138Mg cells, and the cell death is shown here. And these cells were subject to many different compounds. First, as we can see here, the cells are treated with aqueous and organic extracts. So as you can see, we have a high cell death rate of the cells treated with these extracts, mostly apoptosis, but some necrosis. And as we can see here, these cells were treated with organic and aqueous extracts, along with various caspase inhibitors. So this is a pan-caspase inhibitor, ZVAD. ZLEDH is a caspase 9 inhibitor, and ZIETD is a caspase 8 inhibitor. So these cells were also subject to the extracts along with these inhibitors. And what was found is that these inhibitors actually caused a less cell death when compared to the cells given the extracts by themselves, which may indicate that these extracts actually cause apoptosis and necrosis by activating caspase in some way or another. But further studies will help test this. Here we can see the percent of viable cells treated with polymastia extracts versus temozolomide. So as we can see here, TMZ, which is for temozolomide, and aqueous extracts and organic extracts. As we can see here, we have an increased rate of cell death for the cells treated with the extracts when compared to temozolomide. This may indicate that these extracts are more efficient in causing apoptosis and necrosis in these cells when compared to temozolomide, but further studies are needed in order to see if this is actually appropriate. Next, I'm going to be discussing coibamide A. Coibamide A is a depsipeptide. It's isolated from Leptolingbia, which is a cyanobacteria. It's found in Coiba, and it was first found to have anti-cancer properties in 2008. So as we can see here, these were two cell lines, U87Mg and SF295, which were both treated with coibamide A. One indicator for coibamide A is PARP1. As we can see here, we have a full-length PARP1 cleaved, which indicates that the coibamide A caused apoptosis in this cell line after 48 hours. Here we can see that caspase 3-7 activation after coibamide A exposure. Here we can see this was a luminescence assay, and it shows that as luminescence increase and as luminescence is detected, this is also an indicator for caspase 3 activation. So as we see, as the coibamide A dose increases, we also see an increase in luminescence, so an increase in caspase 3-7 activation. And temozolomide also has components that cause cell death, but obviously for very different mechanisms. So these compounds need to be studied further in order to understand their effects. Next, I'm going to be discussing tetrahydroisoquinoline derivatives. So as we can see here, they are alkaloids isolated from Zestospongia. Here, we can see that tetrahydroisoquinoline derivatives actually decrease BBB cell viability. What are BBB cells? Well, they are blood-brain barrier cells. Here we can see the viability of the blood-brain barrier cells in percentages. Here we can see the dosages, increasing dosages of the derivatives. And here up top, we can see the derivatives 1 through 6. And indicated here, we can see that as we increase the dosages of the tetrahydroisoquinoline derivatives, we have a significant decrease in the viability of the BBB cells, which could be helpful because BBB cells really stop medications from reaching the brain and the brain tissue. So if we can decrease this viability, we may be able to increase the amount of medications that reach the tumor, but further studies will help demonstrate this. Here we can see increased caspase 3 activity due to tetrahydroisoquinoline derivatives. So this study measured caspase 3 activity in adherent cells and neurospheres. As you can see here, cells that were treated with the tetrahydroisoquinoline derivatives had caspase activity that increased, but also cells that were treated with tetrahydroisoquinoline derivatives and doxorubicin. So doxo also had an increased rate of caspase 3 activity, which may indicate that these tetrahydroisoquinoline derivatives may cause apoptosis due to caspase 3 activation. But further studies are needed to prove this. I'm sorry, not to prove this. Further studies are needed in order to demonstrate this. Stelletin B. Stelletin B is found in Somalia, and it's been isolated from Stelletta and Rhabdostrella sp. And it was first found to have anti-cancer properties in 1982. Here we can see that stelletin B inhibits motility by interacting with p-gerdin and F-actin. So these are confocal images taken on a confocal microscope. So as we can see, as we increase the dose of stelletin B, we have decreased activity of p-gerdin and F-actin. These both act to increase motility of glioblastoma cells. So if they're less prevalent in the cells, the most likely response to this will be less motility of the cells, and will help reduce the spread of the tumor. And lastly, here we can see the anti-angiogenic activity in stelletin B versus temozolomide. So, as we can see here, this is an immunoassay showing the amount of VEG secreted protein and versus the dosages of Stilla MB given to the cells. And as we can see, as we increase the dose of Stilla MB, the amount of VEG secreted protein decreases. And VEG is important for angiogenesis. So if VEGF is decreased, expression is decreased, the most likely response to this is that angiogenesis will decrease as well. Temozolomide also temozolomide has also been found to decrease the expression of VEGF, but it does so in a slightly different mechanism. It does so by phosphorylating and inhibiting the ERK pathway. So while these two compounds do not inhibit angiogenesis in the same way, future studies may focus on giving these two compounds together, either in vivo or in vitro, in order to study its effects. But obviously, further testing is needed. And for my conclusion and further directions, future experiments should focus on testing the effects of tetrahydroisoquinoline, coibamide A, and Stilla MB in vivo. Corals, plants, etc. should be tested for their anti-cancer properties as well. As we saw, there's a lot of potential for these marine organisms to be part of chemotherapy regimens. And the compounds mentioned above also need to be studied in order to understand dosages and tolerances and maybe possible side effects. So further studies should focus on this. The compounds discussed may also be able to counteract temozolomide resistance. So these are things that need to be kept in mind for future studies and future focuses of these medications and compounds. Thank you for listening. These are my references.